Evening, everybody. I'm Sean Verano. I'm a professor of criminal justice at Roger Williams University in Bristol, Rhode Island. I am also a senior research associate with Kelly Research Associates, and my colleague Pam Kelly is here. Pam, you want to introduce yourself?
Yes, hi everyone. My name is Pam Kelly. I'm an associate professor of criminology at Stonehill College in Easton, Massachusetts, and I'm also the executive director of Kelly Research Associates. And it's nice to be with you all today.
All right. So just in the spirit of time, because we only have a short time on this panel, we will get going. I'm also going to spare you the torture of having to stare at me while we present. The title of our presentation today is Policing and Public Health, the role of technology in facilitating the adoption of effective policing strategies. Now, there's a little bit of a context to this presentation today. This comes out of some of the work that Pam and I have done working across the state of Massachusetts, working with some of the police departments in their efforts to really create more transformative and innovative approaches to the problems of the opioid crisis that has really hit the state of Massachusetts, as in certainly many areas of the United States very hard. So when we look to just a trend of data, for those of you that are not familiar with what's going on in the US, the opioids crisis has really hit many of our states like a tidal wave. Certainly something happened around the year 2012 to 2013 that really created a watershed moment that increased the prevalence of both fatal and non-fatal overdoses. The New England and the Northeast part of the United States has been hit particularly hard, as have areas of the Midwest. And when we look to this trend chart here, we see the year 2017, where the state of Massachusetts had over 1,600 fatal overdoses. And just to give you a little bit of context to that, looking at other problems that often garner a lot of public attention, when we compare those 1,600 fatal overdoses to homicides, there was 171 in the same year across the state of Massachusetts. And when we looked at traffic fatalities, there was 333. So certainly we see that this quickly emerged as one of, if not the most defining public health crisis really facing the state of Massachusetts in generations. Now, in the face of this crisis, many within the policing community were challenged, to think, what do we do about it? And when we look to not the too distant history of policing in the US, when we put police crises, what we've seen is that we don't often produce particularly favorable outcomes. In part, it's because in the US, our responses to emerging threats is often approached through an enforcement lens. That tends to be the primary paradigm through which police organizations across the US imagine and envision our solutions to problems. And those impacts, these enforcement-oriented strategies, have produced questionable outcomes. And certainly we also know there's been a lot of unintended consequences in terms of tensions within our communities that have certainly played into questions and concerns about issues of systemic bias. It does seem to us that there has been something different about this crisis that has really caused this introspection moment and really challenged police to think creatively. And there has been this demand to do something about the problem, but to do something different that has focused on strategies other than just enforcement-oriented approaches or paradigms. And I think a lot of ways, Pam and I, through the work that we have done, because we've done a lot of work with policing over the last 20 to 25 years, have really challenged ourselves to think through, why is this? Why now, and why this problem? And I'm fascinated by this idea that naloxone might have really been an important milestone in the world of policing. For decades, faced with overdose problems, there was really, in many cases, very little that police could do to help people in the context of an overdose. And I think that the advent of naloxone, and many of our police departments around 2010 to 2012 started to experiment with carrying naloxone, gave police officers a tool that they could literally put on their utility belt and do something to help people in crisis. And what we started to see is that as more police started to carry naloxone, and as some police officers started to reverse overdoses, more and more overdoses, they started to ask the question, well, what else can we do besides just reversing overdoses? And I think that question as to what can we do has really prompted some creative ideas. Now, when we think through the limits of that enforcement-only approach, one of the things that's important to remember is that having a sense as to what not to do doesn't really tell us a lot about what we should do. And it's really what's the alternative to enforcement that I think in many ways, even today, when we talk about a lot of the questions about mental health and behavioral health problems, what's the alternative? And what's the alternative is not altogether clear. And one of the things that we know is that innovation has really posed a lot of problems for policing. When we look to the literature, when we look to the history of policing and organizational change, what we've seen is not an overwhelming amount of positive experience or positive examples. And the question is, well, why? Well, if we think, there's a lot of organizational inertia, and we'll talk about it in the next slide. Police organizations aren't particularly nimble, right? So there's a lot of history, there's a lot of practice in policing that really prohibits quick and innovative shifts. And the reality is, if we look to the last 20 to 100 years of police history, certainly in the US, there's also been a lot of shifting expectations and demand on police. So what we see is that US police are often, I think the literature is pretty clear, not very effective at creating or sustaining meaningful organizational change. So just a little bit of a deeper dive, what is it about police organizations, right, that create this innovation problem? Well, the reality is that in many ways, police culture changes more slowly than the larger culture, right? And I think in a lot of ways, police organizations find themselves in this habit of chasing their tail, right? Just as they think they understand what the public wants, just as they are doing organizational shifts to move in that direction, what the public wants shifts again. So it's a moving target. We also have to remember that in the US, policing has a very local flavor at times. And while there's a lot of commonalities about how policing looks across the United States, policing is a local phenomenon. And what we see is that there can be a disconnect between political and organizational priorities. Even within police departments themselves, we often understand that there's difference in priorities between our senior leaders compared to our mid-level managers and our line level staff. One of the other sort of fourth issue here that I would argue is often overlooked within the literature, or certainly not considered as an overt issue, is that even when there is this cultural shift in policing where innovation becomes a driving sort of force or question, our police organizations, both how they're structured, about how they're resourced, about how the business processes work, about how our technology works, much of how these organizations are structured are designed to really support that enforcement mission. So there's a big leap between having that organizational commitment to changing things, but the organization is not always designed to support that kind of shifts. And we talk about that informally, but we don't recognize really the limits to our organizational structures, our foundational organizational structures. So what we do is we're kind of using that backdrop as to talk about some of our experiences across the state of Massachusetts and what we've seen as some of the ways that we've seen organizational change and innovation become institutionalized. So as I had said, Pam and I have a long history of working with police departments across the state of Massachusetts. We're very, I often say, blessed to have that opportunity to have a seat at the table with police departments who are thinking about developing either agency-wide, community-wide, or collaborative approaches to crime and disorder issues. And we do a lot of assistance on issues of program design, program implementation, and program evaluation. So with that experience in mind, Pam and I were approached in late 2016 to work with a county just south of Boston, Plymouth County, to support and to help the police chiefs who were working through just some ideas about how to develop a county-wide approach to overdoses. And in essence, the early part of their idea was that they wanted to figure out the role of police in bringing treatment resources to people who have overdosed living in their community in an effort to try to engage them in treatment. And so as we were doing this work in late 2016 and early 2017, the project team was immediately confronted with data problems. Even though overdoses were and continue to be one of the most defining, again, public health crises to face the state of Massachusetts in a generation or more, there was no standard way of documenting when overdoses occur or to even know when they occur. Police tended to know a little bit about overdoses, about the fatal overdoses, and knew almost nothing about when non-fatal overdoses occurred. Even when overdoses occurred, there was really no meaningful data sharing processes in place across police departments themselves, and certainly the case between police and their other community partners like the medical community, the treatment community, or the recovery community. So these early problems with data and communication really almost stopped this effort in its earliest stages. As we were working through some of this early project planning into early to mid 2017, there was a consensus that, really the police across the state of Massachusetts, across Plymouth County, that they wanted to develop a multi-jurisdictional, a county-wide approach to this problem. And just as a side note, in the New England part of the United States, we don't actually do county government very well. You go to different parts of the United States and county government has a much stronger presence in the governmental infrastructure, not in that region. So this multi-jurisdictional county-wide approach was innovation in and of itself, but really there was a commitment early on and a recognition that if we were going to do it and we were going to make it happen, and just as important, if we were going to institutionalize this, there really had to be a commitment to data sharing, data collection, data sharing, and communication. So as we started to work through this, the stakeholder coalition, the coalition of police chiefs, hospital partners, and treatment specialists really came to a consensus that the program model had to really have three pillars to it. That first was, and again, this is so foundational and so important, but this need to establish standard data collection practices and to institutionalize this data collection. And I think when we started this work, we all recognized that we needed to be able to understand what the magnitude of the problem is today, and we need to understand what the impact of our responses are tomorrow. And data really became an anchor point to that. The second was this shared agreement that the police were going to work in collaboration with their recovery partners to really develop a standardized outreach strategy, meaning what's our theory of change, what's our intervention. The intervention was to partner police with the recovery specialists that when overdoses occur, they would bring that treatment message to people in the community with the intent of bringing those individuals access to treatment. And the third was this commitment to really develop the mechanisms to share information and to communicate between partners. Now, this last point becomes really important because even though the first 2 points we could create political agreement around, the third point was, listen, folks, let's roll up our sleeves. How do we make this happen? And if we don't develop the tools that allow us to facilitate this kind of collaborative policing, this is never going to get off of the ground. So with those concerns in mind, there emerged sort of a commitment to develop a project software to manage this effort. And the Critical Incident Management System, or CIMS, was a software system that emerged right directly out of this collaborative policing project. And CIMS really has three parts to it. This idea that it's a web-based application we were asked almost immediately, and this is not our term, right? We were asked by the police to make sure you develop a system that's cop-proof. And we're still trying to figure out exactly what cop-proof means. But what we surmise at this point, it has to be easy to use by cops. And with that idea in mind, they stress, listen, this has to be a functional software system that actually makes the work of police easier. So SIMS was a software that then has been developed, supports this kind of policing model in Plymouth County, Massachusetts, and is now being used in 300 police departments across the state of Massachusetts. And there's several features of SIMS that we found that really resonates with police. The first is that the system's easy to use. It collects data that police have access to. The system doesn't treat police officers like they're research assistants. It collects data that is necessary for police departments to tell the story of what's going on within these program models. The second is this idea that police figured out really early on, they needed to share data between each other, and they also needed to share data between the police and their non-policing partners. Just a really practical data point that created this imperative to share data even among police. What we've documented is that in the state of Massachusetts, or across the state of Massachusetts, anywhere from 20 to 40% of overdoses are multi-jurisdictional. That means that people overdose in places other than where they live. They overdose in communities other than where they live. And to the degree that our policing is jurisdictionally bound, we're really missing a critical part of that. So this idea of police being able to share data in real time between each other, and then with their non-traditional partners like hospitals and with recovery community, was an anchor point of the software also. Also, police made clear that SIMS needed to facilitate their communication with their partners that they were going to collaborate with, that were doing the work in collaboration with the police. So the software has a communication hub that allows for information sharing between police and their non-policing partners. The system also allows police to manage their workload. If we think about what our record management systems do, our record management systems, like our incident report systems, really are designed to help us document when incidents occur, but not really to manage those incidents in certainly any meaningful way outside of criminal investigations. So SIMS provides a very easy to use dashboard that allows police to know when overdoses occur, what the status of those overdoses are, if the person's back in the community or if they're still in treatment or they're medically admitted, and then when they need to do a post-overdose follow-up visit, and then to document what happens as a consequence of that. This system also has an ODMAP integration. Now, for those people not familiar with ODMAP, it is a data collection priority out of the federal government, out of the Office of National Drug Control Policy. It is a national repository that was developed out of the Baltimore HIDA. And in many states, the reporting of overdoses to ODMAP is a requirement. So our system allows police to report directly to ODMAP through SIMS. And finally, the issue of real-time reporting. The system allows police to know week to week, day to day, week to week, month to month, what's going on with overdose trends. These problems change often season to season, month to month, and being able to tailor your responses becomes pivotal, that you have access to real-time data. Now, the question is, all right, so how does any of that matter? As we started to train police departments across the state of Massachusetts on the SIMS system, one of the things that we realized really early on was that the use of this software, a software that really mapped over to the business processes of policing, was really, what we were finding is that there was a lot of buy-in to this, right? The reality is we've done this kind of work for years, whether it's gangs and youth violence and other substance use related issues. And we never really saw as much of a commitment across a wide spectrum of policing to shift in this kind of dynamic way. And as we started to train to this software, we started to see a real willingness. And in part because training to a software really allowed us to speak in standard language to police, create a standard language that police could speak about problems and communicate problems to other non-policing partners. There was also this idea that when we think about training, whether it's the adoption of community policing, let's take that as probably the last 50 years we've struggled with really moving from training to integration as it relates to community policing. And why is that? Because there's a big gap between training and organizational change. And really what we found is this interesting idea that, it might be possible to actually train people to use software that maps over to the things that we want them to actually do versus getting buy-in, right? What is buy-in? We often try to train in culture change. What we would have police tell us is, and certainly within a policing community, right? Like if you're a patrol officer, listen, you don't have to sell this to me, just tell me what to do. And by the way, make it easy. And so if we could sort of, talk about issues of organizational change, talk about issues of cultural change, but really train on a software application that really mapped over to that change, really was an operationalization of that change in process, it was a much easier sell. And so what we found is that by doing it in this approach, it really was an effective way for identifying and really mitigating those natural barriers that, that make these kind of organizational changes difficult. And it really reduces the impacts of those natural critics within our organizations. And actually, this last point is really, really important, is that the earliest stages when we were trying to get this effort off the ground, and it was really the police chiefs trying to get it off the ground, trying to institutionalize it. We were part of the project team. What we also found was that this early commitment to data collection, really that data collection itself became a real anchor point to the project where we could meet on a monthly basis, talk about data, talk about trends, and really create a shared vision between police and their non-policing partners. That just meeting around data became a really important starting point. So with that in mind, Pam's going to take over, and what she's going to talk about is this idea that not only did this data system, we argue, really help to institutionalize this organizational approach, this institutional approach, but really was an effective tool to create refinement in program models and additions to program models. So Pam, can you talk about some of the other points? Okay.
Thanks, Sean. Yes, so I'm just going to expand a little on the idea of the importance of good data and how can data really affect the success of a program. So we think data can play three critical roles in the development and implementation of any program model, really. First, it can function as a management tool. The decisions of what data to collect really communicates those expectations, as Sean talked about, across partners. And then the data is a tangible outcome that all can see and can benefit from. Second, data lets our program managers know if they're accomplishing what they've set out to do, or is the program actually being implemented as it was originally designed, or as we say, assessing program fidelity. And then finally, data allows program managers, research partners, evaluators, all to measure the stated program objectives. So has the program met the outcomes that were expected, and has it achieved the original objectives? So it allows us to tell the story and the impact that the program has on a community or an agency. I think the most important point of how data is used is once it's collected and analyzed, we often say that good data creates new starting points. And that means once data is available, it can prompt new questions, or the way we think about it, once you're aware of something, is there something else that you should be doing once you know this now? So as Sean mentioned earlier, we found that regularly sharing data, not just with a once a year annual report, but on an ongoing basis is a great way to engage partners in the program model and then have them understand the need for data collection, which often isn't, a favorite thing of people to do. So data can bring to light issues or topics that were not known or considered before. And then once that happens, it's incumbent on the program team to address these new issues and perhaps develop new solutions. So data can create this opportunity for innovation. And if the data is being shared across all staff levels, then everyone feels like they have a voice in the development of these new strategies, meaning hopefully that means there's better participation, there's more buy-in, and there's more engagement. So we have a few examples today for you of how the SIMS technology and the data collected through the software has impacted the program development in our sites around Massachusetts that we've been working with. And this first one here is a fatal overdose trend chart. So just being able to show data trends leads to a better understanding of the overdose issues. And it really allows communities to react in real time as those changes occur. For instance, if we're looking at the 2020 chart, Sean, if you just want to go back for a second.
Sure.
If we're looking at the 2020 trend chart here, we see the red line is 2020, and you can see the trend was rather flat sorry, Sean, I have a different PowerPoint. So you can see those immediate peaks, and in this case, in July of 2019, we had a high point of 19 overdoses. So having this data in near real time allows the program managers to decide, if action needs to be taken in terms of maybe a public service announcement or increased outreach to at-risk individuals. And then the trend data also highlights the importance of this multi-jurisdictional effort that Sean talked about, especially with this post-overdose outreach model. If an individual town was collecting this data alone and not sharing it, they may miss a spike like this. For instance, one town might have 1 or 2 fatal overdoses in a month. They may not recognize this as important, but if multiple towns are sharing data, then 1 or 2 fatal overdoses becomes 15 to 20. And that becomes a clear indication of, perhaps a lethal batch of drugs in the area. And so communities can move forward and take action for that. So from this trend data, the question arises then, what can we do for people before they overdose to get them help? So obviously, no one wants to have to wait for an overdose to occur to offer assistance to an individual, with substance use disorder or their family. So the idea of an at-risk referral was created as an outgrowth of this data. So this would allow family members, friends, police officers, other program partners to refer someone who hadn't experienced an overdose yet, but someone was afraid that this person was at imminent risk of an overdose. So then this individual would be entered into SIMS as an at-risk referral, and this would trigger that outreach team to go and visit that home, offer help, and hopefully prevent an overdose from occurring. Our second example is of the usefulness of this sort of data that we collect is how it allowed sites to understand the problem and the impact of those individuals who experience multiple overdoses or referrals in a short amount of time. So as you can see here, the example we have here is that we had 1,460 overdose incidents that involved 1,185 unique individuals in one of our counties. So we had 84% of the people, or 998, had one event recorded in SIMS, and 11%, 135, had 2 events recorded, and 3% and 34 had 3 events, and all the way down the line to that one person who had 9 events recorded in 2019. So ultimately, this analysis shows that the unique individuals with multiple events were involved in, over 30% of the total events recorded in 2020, just in this one county. So having this data then provides another opportunity for police and outreach teams to target their efforts on those with multiple events, so the 170 or so people, and then potentially have a very large impact on the overall overdose numbers. So this prompted the question that, now that we know about this issue of people with multiple events in a short period of time, what do we do? So from this data, we developed a new strategy. It was called the Tier 2 intervention model. And this strategy focuses on individuals with 3 or more events in 6 months, Or just this past year during the pandemic, we actually added a new criteria of 2 or more events in 1 month because we found individuals overdosing multiple times in just a very short period of time. And tragically, some of those ending up with a fatal overdose in a short period of time. So this strategy is very different from the original program model Sean talked about, that began in 2017, in that it involves ongoing outreach to these tier 2 clients and utilizes more of a case management approach. The county implementing this is Plymouth County, and they've identified over 130 individuals that meet this criteria in just slightly over 1 year since its implementation. And at the end of 2020, they had 62 active people on their tier 2 list. And those people had been involved in 105 events in the last 6 months of 2020, and a total of 342 events since we started collecting data in 2017. So the active clients receive regular, ongoing outreach visits. They're offered continued support throughout their recovery process. And in 2020, it's a huge amount of home visits being conducted, over 920 attempted home visits to those active clients, and they have an almost 60% success rate in having contact with someone, and success is either contacting the client themselves, a family member, or both the client and a family member. Another example we have is that we also map the data collected in SIMS. So, that's to provide that visual of incidents for our program team. And once we began mapping the data, it was pretty clear there were certain hotspot regions in the counties that we were working with. And here's an example of a 2020 non-fatal density map for one county. And you can see hotspot region in the one large urban city in the northwest corner of the county. And you can see 2 more in some tourist areas we have along the water and the ocean. And then there's this interesting finding of this long horizontal hotspot that overlays a highway that runs across the county, passing through several towns. And along this highway, there's numerous gas stations, convenience stores, restaurants, small shopping plazas, which all provide really good locations for targeted outreach efforts. So with this data, that prompted the question of, should we now be conducting place-based outreach in these hotspot areas, which is something we weren't doing? So the answer was yes, we should. And a hotspot outreach strategy was developed and is currently being implemented right now. And the program is going to involve the outreach team setting up a booth in various hotspots at regularly scheduled times so people will know where to find them each week. And they're going to be distributing harm reduction kits, information packets, and just offering resources to anyone in need that stops by. And finally, a last example of how the technology and the data are really being utilized to promote the shift in the policing paradigm around overdose and really other community safety or public health concerns. At the end of the day, the type of public health lens, if you want to just switch to the next slide, Sean. At the end of the day, this public health lens being used by police to implement the post-overdose outreach is really just good policing, right? It's really just a great example of community policing 101, what many police departments strive to do. So police departments that have adopted this program model and are utilizing the SIMS technology really understand this. And so now they're starting to think about what else could we use this model for, this, and expand this treatment first approach. And the first idea that came out of this was to behavioral health calls. Police chiefs have often said their behavioral health calls are 2, 3, 4 times the number of their overdose calls. So we recently created and launched a behavioral health module for SIMS, and that's being piloted right now in 3 towns in one of our counties to see how that works. And then once we did that, we've just recently had some police departments reaching out to ask about adopting the technology for domestic violence calls as well. So that might be the next addition to our system where we're trying to work with some of our departments right now. So, in summary, I think good technology can really be a facilitator for organizational change. Technology can help you move a program from that idea stage to actual implementation and then beyond to new innovations. So data, good technology can provide, foster that innovation, and really at the end of the day, we want to be able to tell the stories of these programs and their successes and their accomplishments. Anything else to add?
That's all that I have. I think what we'll do is open the floor up for discussion or comments. I'm not sure if people can video in or if we'll do it over chat. I'm going to turn off the PowerPoint for right now. And let's see what we have. All right. So there is a question to us that says, Sean and Pamela, examples abound where implementation of new technology has failed or floundered within police departments. Are there lessons learned from your experiences that inform our understanding of how to be more successful of integrating new technology systems within police organizations? And by extension, how do we ensure that officers submit the data? And how do we help institutionalize agency use of that data? Pam, do you want to take that on? Do you want me to take it?
I think, I have some ideas on, and I'm sure, you can feel free to jump in. I think the most important thing that we've learned is you need leadership. You need leadership from police chiefs who have influence over officers, over departments, and especially to get that collaborative approach, respectfully. Sometimes it's like herding cats. So you really need a strong chief or multiple chiefs, which is what we found. Or in some of our counties, we actually have a district attorney that is leading the cause. So having strong leadership right at the start is very helpful to get that initial buy-in. And then I think both Sean and I talked about how it's really important to have that constant feedback loop, to be able to provide that data back to people so they understand it's not just this black hole of a computer system that they're throwing something into. And we provide, monthly reports, quarterly reports, annual reports. Sean and I are always doing presentations for, task forces and the program teams. And in some cases, we quarterly in Plymouth County, we do a huge meeting every quarter with over 100 attendees, and they're all the data designees that put all this data in. So I think those are the things that I would say, Sean.
Yeah, and I don't think I could say it much better besides that early leadership. And then again, Pam had said this notion of making data matter. And that sounds like a simple statement, but really not making data collection too overwhelming. Mm-hmm. But what we found, and I know it sounds a little corny, but when we would be having meetings, and a lot of the meetings involved the patrol officers who are out there doing post-overdose follow-up visits, and just about every one of those 4 questions that were asked that led to innovation were actually asked by the patrol officers out there doing the work. Mm-hmm. So by including them in these meetings and really showing to them, the people that are doing the work, how the data really matters, and then and really having them come up with these ideas, like you couldn't design a training any better, right? Because part of it is, again, how do you transition from training mode to implementation mode? And this really was a way of sort of codifying that implementation sort of process. So if you get leadership, and that was I think the key, if you get that early leadership to commit these agencies to really investing human capital in data collection, but then making it matter.
And I think too, we spend a lot of time working with the officers or entering the data. We're always available for questions. We want to make it as easy as possible, as Sean said. And we really, value all their input. And I think they know that. And I love the moment when you go from telling them what they want to know and providing a report to having them ask you questions. Can you tell me this? Could you get this information? And then you've sold them. Then they get it. Then they understand what this data is doing. And then as Sean said, then they start using it to develop new strategies and how can we do stuff differently. And that's a really exciting time. And we found that in most of our counties that happens pretty soon after we implement.
Okay, there's another question in the chat that says, you have described how technology was used to foster change of police organization as it relates to opiates. To what extent do you think this is extendable to other problem areas in policing, particularly those that intersect with public health issues and public health partnerships? Do you see some takeaways for policing as it relates to homelessness, assisting persons with mental health, addressing sex trafficking? And in many ways, that's what we've seen as one of the most interesting parts of this. So to be honest with you, when we started using the technology for opiates, Pam and I would have conversations with each other, and often a couple of the key police chiefs who were leaders. And Pam had sort of mentioned this already, but it was as we designed the software, what one of the police chiefs said is, wait a minute, I mean, this is just good policing, right? We're identifying problems that are important. We know when they happen in your real time, and we have a tangible response that we're doing, and we want to know whether we actually did it. And I think that it is really extendable to almost any problem like domestic violence, like homelessness, like behavioral health issues, because we're really talking about really problems that matter and problems that need an intentional solution. Pam, I'm sorry, I kind of jumped in without giving.
No, that was perfect. I was just going to add, we do have our new behavioral health module that one police department approached us, and they're sort of a leader in one of our counties, and they have a critical incident team and a response team, and they also do a lot of training. And so they said, this would be perfect. We need a few tweaks, customizations. We need to collect a little bit of different data for this type of event, but the whole model of the technology will really work. And so we worked with them all last summer, and we were able to launch that this fall. And from what I'm seeing, because I'm just doing my first analysis of that data right now, it's actually working very well. And it's also going to allow them to, again, share information across communities, because mental health calls are also, or the behavioral health calls are also going to be multi-jurisdictional. So that's going to be a big addition for them. And also just to be able to track all those outreach efforts, who's doing outreach, what are the outcomes of those? So I think it's going to be very helpful. And as we said, we just like 2 weeks ago had a police chief approach us about, perhaps using this for domestic violence as well. So we do think it's definitely expandable to other areas.
I think that Nicole said she can open up the floor to ask questions. So if anybody wants to ask a question, please do. Questions, comments, you can chat in, you can ask it. Well, as often happens, I speak enough that it ruins any innovative conversation. So again, we're happy to stay here, address any comments, questions, insights into the issues. Otherwise, it's certainly dinner time in a lot of places where people are right now.
That might be. It's Monday afternoon at 5:42. So exactly. we would not blame you if you were trying to get off to dinner somewhere.
Exactly.
Yes, if there isn't any more questions, we can conclude the Zoom.
Okay. Sounds like let me just one, maybe, let me just check the Q&A. Actually, there was one question in the Q&A from Erin. It says, thanks for this excellent presentation. I was curious to know, have you collected demographic data as part of this work? Was there any community engagement to determine what metrics were appropriate and how to frame those questions? Erin, what I will say is, and this certainly could be a shortcoming of the collaborative process, there was community engagement. The community engagement was largely among the stakeholders that were part of the healthcare community, the recovery community, and the treatment community, with partnerships with the police. Quite frankly, some of the when we get into the recovery community, it's a diverse group of stakeholders. I mean, you get mental health experts, you often get veterans, advocates. So by definition, it often attracts, and in the case of the work we've done across Massachusetts, it often attracts a diverse set of stakeholders. But in terms of the larger community, the short answer to that is no. We do collect demographic data, but we are very sensitive to protect that data. Pam, I don't know if you just want to mention a little bit of the stuff, the work in Brockton with having access to data about making sure that we are actually addressing the needs of our community of color. When we would sort of regularly monitor the data to make sure
Right. Yeah. As Sean said, we do collect demographic data. We collect, gender and age and race and ethnicity. We collect homeless data as well, because we find that a large population, a good percentage of our population does tend to be homeless in some of our larger urban cities. So we do collect that sort of information. And what we've seen in one of our programs in Brockton, which is that hotspot area we saw in the northwest of the county, is an increase in participation with minority clients. And we've seen that sort of regularly over that particular program is a similar program, but slightly different. We won't get into details, but we've seen an increase of, non or minority clients from 2016 on to now it's about 34%, where it started out around the 12 to 15%. Is that what you were talking about, Sean?
Yeah, and just that idea of knowing who's calling the police to report their overdoses, or who's
right.
who is getting assistance from 911 systems, to make sure that our systems are effective at engaging the broad cross section of
right.
people in our communities who really suffer from the disease of addiction. If you don't track that data, and you don't know who's calling the police, and you're not monitoring that data, it's quite likely that we're missing huge cross sections. So I think tracking that data becomes not only a metric for knowing what's going on, but who we're actually missing within our communities. Often not easy answers to these questions, but at least knowing who we're missing, who maybe isn't calling 911 because they don't think the police care, or they don't think they're going to get help. It allows us to do specific outreach efforts to those segments of our community. Anybody else? All right, well, we appreciate everyone's time. We would like to also thank Nicole for her stewardship of the technology. That's no easy task in these efforts. So we just thank everybody for coming. We hope you've had a great conference, and we hope to run into you on other panels. So thank you.
Thank you so much.
Thank you, Nicole.
You guys have a good night.
Thank you, Nicole. See you, Pam. All right, bye-bye.
Bye.